Good morning and welcome everyone to County Executive Pittman's virtual press conference. This morning, the County Executive will share updates on the county's COVID efforts and on grant application opportunities. We'll take questions after those updates. As a reminder, please put your name and media affiliation in the chat, and I'll call on folks for questions in that order. Please keep your microphone and camera off unless you're called on to ask a question. With that, Mr. County Executive.
Thanks, Jeff, and thank you everybody for joining us this morning. So I guess I should start out with the state of the pandemic in the county and note that the mask mandate remains in effect through the end of this month. I think much has been said about the council hearing last week on that. And if you want my thoughts, you can read them in the column that was published in the Capital Gazette this morning. But I do want to ask the public to hold our hospitals in the light, to have patience, thanks, and do all that you can if you go to a hospital or you have to interact with the hospital, to be patient with the staff there that is dealing with unprecedented stresses and numbers of patients in the hospital, as well as low staffing shortages. I also want to thank Dr. Marcosi from the University of Maryland Medical System that runs our Baltimore Washington Medical Center, and Dr. Meisenberg from Arundel Medical Center, and Dr. Vinema from Johns Hopkins for taking the time out on Friday to educate the public and educate our county council on the state of the pandemic and how it's impacting our hospitals right now. I also want to ask parents in particular to be patient with the situation in our school system. In fact, in our school system, as well as private schools and really all institutions and businesses across this county, as a result of the numbers of people that are out with COVID now. So everybody is trying to provide services with fewer staff. That goes for all county agencies as well, and public safety. So this really is a time for grace and patience, and for all of us to lean on one another and help one another out. I want to say something positive, though, about a program that assists the local nonprofit community-based organizations in our county. We started a program in our first budget, or I should say we restarted a program that used to exist in Anne Arundel County to provide direct funding to nonprofits to do work in the communities. And it was very important to our administration that it support the nonprofits that are supporting the most vulnerable among us. They provide services to the people who need them most in the places that it's needed most, and they do it efficiently, often more efficiently than government can do it, and closer to the residents. So we established the community support grants in our first budget. They delivered for us during the pandemic. We have been able to expand that with the help of federal assistance, and the grant program for applications is opening now, and it will be open through February 21st. And last year we funded 52 community-based organizations for a total of $1,863,000 of support. We expect to be able to do something similar this year. Of course, all of these grant approvals are contingent on approval by the county council in the budget that we will all be considering in the coming months. But it was absolutely, it's necessary to get this process started and get these applications in now. So these applications go to Arundel Community Development Services. They manage this process and they work with these nonprofits, and it's one of the programs that I'm most proud of in our administration. So I'm thrilled to announce the opening of the grant portal. There's another program that is smaller but equally important, which is through the Anne Arundel County Arts Council. And that also is opening to support independent artists in our communities. And it's $2,500 per artist. There's an application portal there as well. We have 150,000 dedicated for that program, and very soon we'll be opening a portal through the Arts Council to support with $350,000 the arts organizations as well. So we've been doing this with federal assistance during the pandemic, and found that a little money goes a long way with these struggling artists to keep them doing what they do to improve the quality of all of our lives. And then finally, we have budget town halls started last week. We did District 2 last week. Really great presentation by our budget officer and myself about the situation, the status of county finances and how we do the budget, and then hearing from residents about what they want to see in this next budget. So we're doing District 4 tonight with Councilman Pruski, and doing District 3 on Thursday with Councilman Volke. These are done online. We moved them online due to the COVID rates, and you can go to aacounty.org/budget town halls to get all the information, or you can just to be able to log in and make comments. You can also watch it on Facebook on the County Executive Facebook page. So I will stop there and pass it over to Dr. Kalyanaraman for some more COVID updates, and then we'll open it up for questions.
Thank you, County Executive. So our COVID updates are that we see that our hospitalizations are continuing to increase. They're up to 260 between the two hospitals. It's 60 more than last week. We're seeing that ICU cases continues to increase as well. The occupancy in our hospitals is over 90% at this point. Baseline threshold is 70%. So they're under a large amount of stress at this time. Our case rate remains high at 168. Our percent positivity is at 29%. And I think most critically, deaths continue to rise, with 18 more people who died from COVID last week. We're still operating under a statewide state of emergency and a declaration of a catastrophic health emergency. I think it's really important at this time. We are pushing. We know what we need to do. Get vaccinated, get boosted. People who aren't vaccinated are the majority of those hospitalized for COVID. People who are vaccinated but not boosted are most of the others who are hospitalized. So protect yourself. Wear a mask in public settings. We have the mask mandate. Omicron is very contagious. So we want to make sure people know that they use a good quality mask, either a KN95 or surgical mask. Those are the best. If you're using a cloth mask, make sure it has multiple layers and a filter. So with that, I will turn it over to you, Jeff.
All right, we'll take questions. If you could put your name and media affiliation in the chat, I'll call on folks for questions in that order. Kate Amara, WBAL.
Hi, good morning. I have, of course, I always have more than one question, but I'll start with what Dr. K just left off with. Both of you are among public health officials and elected leaders across the state and the country who keep stressing how important it is to get the booster shot, because it will save your life or could prevent you from having severe illness or being hospitalized. Yet you have not added a booster shot to the county's definition of fully vaccinated. Are you thinking about it now, this week? Has anything changed? If so, why or why not? And I just want to add that under the current definition of fully vaccinated everywhere, for a state employee or a county employee, if you got one shot of Johnson & Johnson way back in the summer, you're considered fully vaccinated. So are you going to add that to the definition of fully vaccinated in the county, and why or why not? Thanks.
So there are active discussions at the federal level on updating the definitions of what being effectively vaccinated is. And we do want to make sure that we're consistent with the rest of the state and the rest of the country on this. So I know that's a topic that we'll get more clarity on in the coming weeks. County
Executive Pittman, could you weigh in on this too?
Yeah, well, what I would add is that we have staffing shortages as a result of COVID, people being out. And we are not actively looking right now at ways of reducing our workforce with additional demands on them that people who have been vaccinated with 1 or 2 shots are our group of people who understand the value of vaccination. And I don't believe that creating a new mandate right now that says that in order to work here, you have to have had your 3rd booster is gonna have a positive impact. The value of that would go above whatever cost there is in terms of staffing.
Thanks. That makes a lot of sense, that answer. And since my follow-up to that is, Dr. K, you mentioned the feds may update their guidance. The CDC's new guidance on if you have an exposure and how many days you need to stay home and do you test or not is so confusing to so many people. I'm hoping that you could at least clarify it for the county workforce. What kind of guidance do you have in place now for somebody who works for the county, who had an exposure or is sick? How long should they stay home? Is it 5 days? Is it 10? Is it from when they have symptoms or from when they test positive? What's the rule right now for your workforce? Even that question was confusing. Sorry.
So, the guidelines, we've heard this a lot and we understand this, that the guidelines are confusing. They are hard to apply. It's a little bit more straightforward for those who have COVID and are isolating. It's more nuanced for those who are close contacts and are quarantining. There's considerations of the setting you're in. Are you in a congregate setting, working with vulnerable individuals? Have you been vaccinated? How many, as you noted earlier, have you gotten boosted if you're applicable? I don't think I can go over all of those nuances right now, but we do try to work with, whether it's agencies or different sectors to make sure that those guidelines are as clear as possible, but working within the CDC framework. It is definitely something that we've elevated, that having simpler guidelines would help in their uptake.
Thank you so much.
All right, next up, we've got Amy Simpson, Fox 45.
Great, thanks, Jeff. I have a question for either the county executive or Dr. K, whoever feels best to answer. So with a different mechanism used Friday to re-implement the mask mandate, I'm curious what level of compliance you all are seeing right now with following that mask mandate with this latest continuation of it.
Well, I could let Dr. K certainly weigh in. And we don't have obviously comprehensive reports on mask wearing in public places, but anecdotally, I can tell you that while I've not been out shopping much, my wife has, and in particular in the southern part of the county, has noted a significant increase in mask wearing in stores where they were not wearing them before. And that's good news to me. Any additional mask wearing is likely to slow the spread somewhat of this virus. And while we know we can't stop this surge, anything we can do to save a life or keep some people working who would otherwise be at home is worth doing. So there are people definitely wearing masks who were not before.
Great, thanks. And then second question, has there been any indication of a legal challenge to this mask mandate?
I have not heard of one. I have heard a lot of questions about it, but I have not heard, the explanation from our Office of Law, Greg Swain, I thought was very clear. I think the law is very clear. And so while it wasn't the first choice of our health officer to use that law, and our county council had requested have the authority to be able to debate and make decisions about these orders. The law is very clear that a professional health officer can and should step in to protect public health.
I appreciate it, sir. Thank you. Stay healthy, everyone.
All right. Next up, we've got Mike Helgren, WJZ.
Hi, I have two questions. The first for Dr. K. How difficult is it to obtain access to monoclonal antibody treatments right now? And do you have the Pfizer antiviral pill? Is that difficult to get for people who do test positive?
So the monoclonal antibodies, 2 of the 3 are not effective against Omicron. So that's really the big issue with monoclonal antibody supply. That third monoclonal antibody is also the one that's least carried. In terms of the Pfizer and the Merck oral antiviral pill, those have been made available by the federal government to pharmacies throughout the county and the state. And as production increases, that availability will increase. The big key for folks to know is that you do need a doctor's order to get that. Any doctor can provide that, but it is a prescription medication.
And my other question, perhaps for the county executive, is where do things stand as far as staffing and people who've had to call out sick because they're positive on the public safety front or other county employees? Any information that you might have on that?
Yeah, I don't have numbers, but I have heard from the school superintendent that staff that normally works in the central office and does curriculum work, and even that does some of the virtual education, is being asked to go out into the schools to fill positions for teachers who are not in. So, but I don't have numbers for you.
Thank you very much.
All right. Next up, Rob Lang, WBAL.
Hey, good morning. Question for both Dr. K and the county executive. And so just to follow up from last Friday at the council meeting, there was a woman she was either a bartender or bar manager, complaining about the mask mandate, saying it puts her employees in a very uncomfortable position in trying to enforce this. How do you address that? How do you address enforcement, especially as you're going to tell business owners you've got to enforce this mask mandate?
I had some thank yous that were coming from the opposite perspective, owners of restaurants thanking us because it makes things easier. Maybe those were owners who were trying to keep their staff safe, knowing that their staff was wearing a mask, but their customers were not. And I know that there were businesses that had attempted to implement mask mandates when it was not coming from the government, and that there was a lot more pushback in those cases because it wasn't mandated by the county. And so I think it's helpful for them to be not the ones making the decision for their customers, but it's the government and it's a requirement. And the enforcement is complaint driven, and we've not been closing businesses down for this. So I think the businesses understand that we're all in this together, and we're trying to get as many people wearing masks as possible. But there will be some who don't comply, and and the chances are they'll get away with it. I mean, we can enforce, but as we all know, enforcement is difficult in a situation like this, especially with the staffing shortages.
Thank you both.
All right. Brittany Werner, WMAR.
Yes, good morning, everyone. So my question is about those established community support grants. This is probably a question for the county executive. You mentioned that some of the nonprofits in the community actually do a a better job sometimes, or a faster job with getting to the community than the government can. Can you, one, name some of those nonprofit organizations that you were speaking of, and in what ways are you referring to as far as them sort of getting to the community a little bit quicker?
Yeah, so the food distribution system that was created when the pandemic started was led by a lot of nonprofit organizations. We had the Anne Arundel County Food Bank providing a lot of the food, as well as the Maryland Food Bank. We funded that with our federal money so that, that the food was actually there, but setting up the distribution systems in communities was, has been, and it continues to be often done by faith organizations, and sometimes small organizations that were created with similar missions, but they weren't doing that exact work before. You know, Feed Anne Arundel is an example, and of one that actually coordinated with restaurants, and it was organized by a restaurant owner. And so she was able to connect quickly, connect through some other nonprofit organizations. Sometimes we do this well in government, but the actual work and getting the volunteers, these nonprofits don't have as much of a liability concern. They don't have a lot of the, I call it red tape, that the government has, a lot of the regulation. And so they can very often move faster. And this is true in the housing arena as well. A lot of health and human service work is done by independent organizations. And I've been supportive of that, having run nonprofits myself for a long time. We have a list of all of these organizations. If you go to the link in our press release to ACDS, where the applications are, there's also a link to the 52 organizations that were funded last time.
Awesome. Thank you very much. I'm new here. That's why this is my question, but thank you guys. Everybody, stay safe.
Thanks, Brittany. Next up, Kate, we're going to finish with you. I'm going to go to Dana Monroe at the Capitol, and then Kate Amara, WBAL, will have last question.
Hi, I'm wondering, as cases get worse and we know vaccines help, would there be any point at which you guys might start, either the county executive or Dr. K, trying to enforce more vaccinations, whether it's getting into a store with a vaccine or requiring it for people outside the county or outside of county employees?
We have talked about that. I was pleased to see the Annapolis Symphony as one example of an organization that requires vaccination to attend. I had thought that more businesses would implement that than have. I'm seeing other jurisdictions moving in that direction. I did not believe we had the votes on the council to implement that. But I think that it's a topic that we have to continue to discuss.
All right.
No plans are underway to implement it anytime soon. It's not coming soon that we know of.
Thank you.
Kate Amara, WBAL.
Hi, I remember you talking about that like a year ago, that you were looking at vendors to do that. It's just interesting that sometimes I feel like it was yesterday. Sometimes I feel like it was 5 years ago. But one more question about boosters and vaccines.
Let me just say.
Oh, yep.
Let me just say on the vendors that was simply to have a, some people call it a vaccine passport, a simple way that you couldn't cheat to show that you were vaccinated in case businesses or anybody wanted to check vaccination, as opposed to actually implementing a requirement that there be vaccination.
Oh, thanks. Thanks for the clarification. So a last question on vaccines in general in Anne Arundel County. The state, as far as I can see, is not putting out booster data for the state, or maybe there is statewide, but not by jurisdiction. So I'm wondering if you know the total number of booster shots that have been administered to Anne Arundel County residents, what that brings your total percentage of, I guess, vaccinated and boosted up to. And if that uptake is in line with the health department and the administration's goals, and also if the current uptake for the vaccine among 5 to 11-year-olds, if that current percentage, how that falls in terms of what your goals and expectations had been. I know even people who thought that 5 to 11-year-old would be low have been surprised by just how low it is in other jurisdictions.
So the data for the boosters is that approximately 53% of people 18 and older who are eligible have received a booster, and right, that eligibility number changes by the day as more people enter either the 5th, 6th, or 2nd month after their dose. So that makes it a little bit more complicated to be able to calculate that, and that's something that we're working on resolving. The other piece is for 5 to 11. Approximately 38-39% have gotten at least one dose, and then about 26-27 are fully vaccinated. Definitely lower than what we were hoping for. We're continuing to push that. We're definitely seeing that children who are vaccinated are protected against the more severe consequences. It may happen less often, but it does happen to children.
Thank you. Thanks.
All right. Thanks very much, everyone. We'll see y'all next week.